Patricia Trim. Welcome you to another edition of Tots and Teens in Focus. Today we have a very special guest, and she is no other than Dr. Nanette Thomas, the chairperson, Ambulatory Care, One Brooklyn Health at Brookdale Hospital. Dr. Thomas will be telling us more about her function and her office and what it consists of, and how she can help the community whenever there's a need for them to go to the hospital. Dr. Thomas, welcome to Tots and Teens in Focus. I know you're not a tot or a teen, but you just arrived. Smiling, beautiful, that beautiful, shocking, pink, red dress. It makes this show look more powerful. Dr. Thomas, I would like you to introduce yourself.
Thank you. As you stated, I am at One Brooklyn Health at Brookdale, where I'm the medical director of ambulatory care, where we have 5 community sites, all within 1 or 2 miles from the hospital itself. And we serve the Canarsie and Brownsville communities. And I've been there for close to 3.5 years, doing extraordinary work, reaching out to the community, and especially during the COVID pandemic. I think we've really done some exceptional work in the community.
Dr. Thomas, I know you said ambulatory care, but a lot of people may not know the word ambulatory care means. Can you explain that?
Sure. Ambulatory care is your primary care, your specialty care. When you are an outpatient, when you're at home and routinely getting your visits with your doctor, it's ambulatory, as in walking to the clinic or to the office to see your provider, as opposed to inpatient care when you are hospitalized and you are receiving care in the hospital as an inpatient.
I know there's a lot of multiple sites throughout Brooklyn for this One Brooklyn hospital system that they have.
Yes.
Can you tell us more about it?
Well, absolutely. Let me explain. One Brooklyn Health is a combination of now 3 community hospitals that had previously been freestanding. As of January, Kingsbrook Jewish Medical Center, Interfaith Medical Center, and Brookdale came together to pool their resources and to really form a hospital that was large enough to compete and be able to really manage the care of the communities that we serve. So having come together, we've now all taken on the name of One Brooklyn Health, and we are now having 3 campuses instead of 3 separate hospitals within that healthcare system.
And what about the specialties of the different hospitals that you are responsible for?
Well, I can say that at our Brookdale ambulatory care sites, we have first primary care, which is adult providers who take care of all individuals over the age of 18 years old and ensure that they have their preventive health, such as pap smears, mammograms, colonoscopies, etc. So we help to ensure that they maintain good health and observe their blood work, ensure that if there are any problems, we can refer or manage their problems accordingly. In addition, we have at a number of our sites various specialties such as endocrinology, cardiology, who come to the sites and on a regular basis are there to again help and assess, manage our patients' care. In addition, we also have evening hours, weekends. We're trying to ensure that patients, no matter what their regular work schedule is like, they'll have an opportunity to be able to come in and see their primary care or specialty care providers.
You mentioned a word in endology care, endology care. Is that the word? The care that you have. You mentioned a word of endology care. Am I
endocrinology.
Oh yes.
Endocrinology are specialists who help take care of diabetes, thyroid dysfunction, pituitary dysfunction. Yes.
Okay. So our folks could really understand the word. I know you partnering with many food banks in the area for the purpose of you starting another program giving food to the to your patients as they come in, or any person in the community that would like to have any type of food from the food bank?
Yes. Well, One Brooklyn Health has taken the COVID pandemic very seriously. We last year partnered with the food bank and the Greater New York Links chapter to be able to provide food deliveries to a large swath of our individuals in the community. We know that a lot of people, because they were not able to work or loss of jobs, there was a lot of food insecurity, and we tried to help bridge that gap by having these food distributions throughout last summer. More recently, we have worked with these partners again to distribute foods at our community sites. So every day of the week, we are doing COVID vaccinations. And in addition, we're also doing food distributions at those sites, again, to the community to try and encourage certainly that patients would get vaccinated, but also again, to help ensure that everyone gets a meal that they can use hopefully for the week. Through the food bank, we're able to give them shelved foods, canned foods, as well as fresh produce. So it is really a great opportunity for individuals, whether they are patients in our clinic or just from the community, they can stop by and pick up their distribution, their food distribution.
How often is that?
It's every week at each of our sites. At Brookdale, we have 5 different sites in the community. So if you go to our website, you can see which site is closest to you, and it will also have information of which day of the week you'll be able to come by and get that food distribution, which is typically between the hours of 10 in the morning and 4 in the afternoon.
So it's like an every day serving at different centers.
That's correct. That's correct.
So if they have it this week, could they come back and not a day next week? You know, some people go
They could go to each one of our sites. So they could essentially be picking up a food basket every day of the week. There is no problem with that. We're not taking names. We're just wanting to help ensure that everyone who's interested in getting a food basket would get one.
Okay. I think I will have to come there and get some food.
It's really good food. Brand names, really excellent choices. So we really encourage everyone to stop by. It's a great opportunity.
Dr. Thomas, I know that you were a nurse, or you became a doctor, or you are a medical nurse practitioner. Which one are you?
I am a physician, but
Okay.
I think you raise a great question, because in our ambulatory care sites, we do have a number of other different types of professionals who are providing primary care. So I have received my medical degree from Boston University, and then I've done additional training where I was board certified in internal medicine as well as rheumatology. Rheumatology is a specialty that where you manage patients' arthritis, such as osteoarthritis, rheumatoid arthritis, as well as some musculoskeletal diseases such as lupus you've heard of, or scleroderma. So that is my specialty that I do.
Oh.
But we also have nurse practitioners who work in our ambulatory care sites as well as our urgent care. These are nurses, typically RNs, who've gone on for additional training and have learned a lot about primary care. They could be nurse practitioners excelling in adult medicine or geriatric medicine or family medicine, but they are also able to provide primary care to the patients, and they work alongside the physician. And physician assistants is another type of specialty, another type of licensed independent practitioner. We do not have them in our ambulatory care sites, but you may see them working besides a physician in our hospitals. Typically on our surgical specialty side, you'll see physician assistants.
You mentioned the word leukemia. Is there a center especially at Brookdale Hospital, because I know of one child that was coming there to the hospital. They have a special care system that are just that Brookdale is a special care system for leukemia than
For
any other hospital in the.
For leukemia, we have a wonderful oncology service that takes care of individuals who have blood-borne cancers such as leukemia.
Okay.
So yes, absolutely. If you have an individual who is needed to have that kind of care, we certainly provide it at Brookdale Hospital, as well as our other 2 sites. Since the merger of the 3 hospitals, Brookdale is primarily responsible for our inpatient services. That's where we're going to have most of the patients hospitalized. Kingsbrook Jewish is now a campus that will have a lot of ambulatory care sites. They are in the process of completing what will be called their ambulatory care village, where they'll have a large nidus of primary care as well as specialty services. And at Interfaith, in addition to having a smaller in-hospital practice, they will have more of dentistry as well as behavioral health. So, you know, we're splitting up our resources to some degree, but if you come into the One Brooklyn Health System, we will help ensure that whatever your needs are, they will be managed and addressed accordingly.
Okay. Does Brookdale Hospital or the one Brooklyn, you know what I mean, hospital, do they have an oncologist there? You all have oncologists at the hospital?
We have oncologists, yes.
Okay.
Yes.
Okay. So if someone wants to come in there to see the oncologist, because you know Kings County does not have an oncologist now. So I don't know if they're referring patients to your hospital to see the oncologist.
Absolutely. We have a good department of excellent oncologists who have been highly trained, give specialty care in a large number of cancer treatments. So it would be certainly reasonable to make a referral to Brookdale to have that kind of care addressed. Absolutely.
Mm. Dr. Thomas, how do you express yourself in this field that you, as a chairperson, to say, well, you know, it was a man's job and now it's a woman's job?
Well, I was really lucky enough to come up at a time when I think society was, you know, giving a little bit more opportunity for women to enter the medical field, you know, not reach the ceiling of being a nurse, but really giving them the full exposure of what being in medicine could provide. And I came along in the 80s when I entered medical school. And by that time, we were about 30% of the class for women. And I think to a large extent now, you'll see some classes of 50% women, if not more so, if not exceeding that. So women are taking on all types of challenges. We are excelling in all different fields in medicine. So you don't really feel that there is any limitations to what you can achieve. You base your goals and the type of medicine that you decide upon based on who you are, the type of medicine you enjoy, whether you like doing procedures or you prefer, you know, spending time and talking to your patients and having more of an office type of approach for your medicine. So there are so many opportunities, especially research. If you want to do administration around medicine, there are just a lot of great opportunities. So for those young people who are considering this as an option, I would ask that you take the time, speak with your own provider, pick their brains and find out what their process was like. Do a lot of reading. There is so much information now on the internet that you can find out what each step is like. the kind of building of a career essentially that you have to have while you're in school, and go for it. As long as you have the drive and you have the desires, you can definitely achieve it. And it's been a wonderful career, especially in ambulatory care. I feel extremely fulfilled and truly blessed in being able to help so many individuals and helping ensure that we're making sure our community is really well managed and that their care is in utmost and receiving quality management.
Is this your first institution that you work, or you work at other institutions before?
No, I've been at quite a few institutions before coming to Brookdale. I've been the medical director of ambulatory care also at Woodhull Hospital, which is a hospital in the New York City Health and Hospitals arena. I was the chief medical officer at another organization called Centralite, which has a large number of programs for the elderly called PACE programs. I've also been the medical director at a couple of nursing homes. So for about 10 years, I was in the nursing home arena. So, you know, I've been able to experience a lot of different venues in medicine. I will say ambulatory care has been very much near and dear to my heart because I've wanted to give back to the community. I want to make sure that people who have less opportunities are still able to get quality care in their own neighborhoods. And I feel very strongly about that.
Your views about parents and child relationship. Our program is Tots and Teens program. So I would like you to give your views about parents and child relationship in healthcare management.
Well, you know, we often think of the mother as sort of the soul of the family. She wants to help ensure that her children get a good start, that they receive their immunizations, that they're, you know, getting their dental care, their eye care, ensuring that everything is progressing well so that they have the best opportunities for good life, that they do well in school, that they're able to be active and enjoy their life to the best of their ability. As a woman also, you are managing the care of your family, of your husband, again, ensuring that he is seeing his primary care provider and getting his preventive health skills. And then as a woman yourself, not only managing your primary care, but then the additional needs for maternal health, for women's health, to ensure that you're getting your mammograms done, that you're getting your pelvic exams and your pap smears done. All of these are critical. And, you know, you at Brookdale and One Brooklyn Health, we're trying to ensure that it's really family health that we're addressing. We have a number of family health providers who can see the whole family, pediatric, adult, even as you're pregnant, and during your pregnancy, they'd be able to manage your care. So it's holistic, it's well-rounded, it's family-centric, and that is truly the kind of care that we're interested in providing for the community.
My final question, what would you, I know that people were very scared of coming to Brookdale Hospital once upon a time. How would you encourage them to return back? There's a better service, there's a better opportunity, there's healthcare facilities, and there's lots of, even the food bank is there. How would you encourage our viewers? Because I'm still telling them, you can go to Brookdale Hospital. They said, no, not me. I said, no, they have a very good system there, so you can go. So how would you reach out to them?
I appreciate that. And I do know that there was quite a reputation, unfortunately, that had developed over the past 2 years. But I encourage everyone to realize this is a new day. We have really focused on bringing providers who are only interested in helping improve the lives of the community that we serve. And that is critical to us. We will not tolerate anyone who treats our community as lesser than. We want to ensure that they receive quality care. One of the diseases that has really been rampant in our community is diabetes. And that is brought on by a large number of factors, such as being overweight or obese. And it can affect just about every organ in the body, leading to the highest risk of blindness or kidney failure. It's affiliated with hypertension. So if we can address individuals with their diabetes care, we address a large number of problems that patients in our community exhibit. And by ensuring that we give quality care, all of our adult providers have received excellent training and have all been deemed as NCQA providers of excellence in diabetes care. We have also started a new program for our pediatric and adolescent groups that is affecting obesity. So we're trying to help them understand from a very early age how important it is to exercise, to eat appropriately. And we're addressing that not only with the child, but with their family, because we realize the child doesn't live alone. It has to be the family that understands how to eat accordingly. So we are very much focused in ensuring that diabetes is treated in an excellent fashion, that our hospital is a center of excellence around diabetes care. We're also looking to become a center of excellence in cancer care. Cardiology is par bar none of an excellent level. So we have a very strong subspecialty commitment to managing our patients' problems, as well as a very strong primary care unit. So we encourage everyone, you'll be treated with respect. You'll be treated with, consideration of all of your concerns and needs, and understand that we have a multidisciplinary approach to helping ensure that you will receive the best care.
Thank you very much, Dr. Thomas, for that wonderful educational lecture. I got this is lecture because a lot of people may not really understand. So the lecture of giving us insight of what goes on in Brookdale Hospital and what you can get from Brookdale Hospital, and the medication, and it's free medication, right?
Well, now free is a strong term. Most people do have Medicaid or a Medicaid program, so it would be covered through our pharmacies. But we also have, for those individuals who have no insurance at all, we do limit the amount of money that has to be paid for a visit or for your medication. Yes.
That's what we want the hospitals to do to help people, especially those who are undocumented, don't have a job, but they need medical assistance. So thank you very much for this talk. I must say, you have two persons in your institution who is very supportive to my program when I have my health fair. Miss Favors, Nicole Favors, and Sharon Devonish Lee.
Yes.
I just want to thank them because they're the one that keep this program going. And I thank them that they have Miss Sharon. She said she will find doctors to talk on my show. So I'm so happy to be a part of Brookdale. And I'm with Brookdale for a very long time because of my health fair. And they never leave out any stand health, what do you call them, the vendors to come to the health fair and to share to the community. And this year I had Miss Sharon Devonish Lee. She was able to talk on my program on the Woman of Power Talk, and tell us about the different institutions, which was very good. And I intend to continue that type of talk on the Woman Talk, because Woman of Power, because this is what we will able to get more advice on Women of Power for our community. Thank you very much for being on, and say hello to those girls to me.
Thank you. It was my pleasure to be here. I truly appreciate the opportunity.
Okay. That was Tots and Teas in Focus with Miss Nanette Thomas, the chairperson for the ambulatory care of Brookdale Hospital. And she gave us so information, and I know that you viewers will surely want to go to Brookdale Hospital, not only for the food, but for the different medical needs, your medical needs, and for seeing your doctors. Stay with your doctors. Stay away from Getting diabetes, that's the worst thing that will affect your entire life. So once again, thank you, doctor, for being
My
on.
pleasure. Take
Nanette
care.
Thomas.